Welcome to your lecture on phosphodiesterase inhibitors. There are so many different types of phosphodiesterase inhibitors, but today we will be talking about the main ones. So let's get started. Now, first of all, we're going to start off the non-specific phosphodiesterase inhibitors. An example of a non-specific phosphodiesterase inhibitor is theophylline. Now, moving on to phosphodiesterase 3 inhibitors. Usually these medications end with the suffix of mol or zol. For instance, amrinone, milrinone, dipyridamole, or cystazole. Phosphodiesterase 4 inhibitors has a suffix usually ending with a last or last, like apremilast and roflumilast. Phosphodiesterase 5 inhibitors has a suffix ending with a phil, like sildenafil or evenafil. Now, phosphodiesterase inhibitors essentially prevents the degradation of cyclic guanosine monophosphate and cyclic adenosine monophosphate, which ultimately causes vasodilation in blood vessels on the peripheries. This also decreases platelet aggregation in primary hemostasis and decreases inotropic effects on the heart. Phosphodiesterase 3 inhibitors particularly works in several places of the body. Its effects are made by increasing cyclic AMP levels within the myocardium, peripheral vasculature, and platelets. Now, this actually increases its stimulatory effects by dumping calcium into the myocardium, but eventually leading to decreasing cardiac tone and ultimately leading to vasodilatory effects and platelet aggregation. Phosphodiesterase 4 inhibitors are stationary in the lungs and its surrounding vasculature. Essentially, its function remains the same by preventing the degradation of cyclic AMP, which leads to the accumulation of cyclic AMP in the pathway. This then decreases pro-inflammatory mediators, hence its function on COPD. Ultimately, this leads to the relaxation of bronchial smooth muscle. On the right, you can see a plain film chest X-ray of a patient with COPD. Now, what about phosphodiesterase 5 inhibitors? Once again, it works by decreasing cyclic GMP and increasing intracellular cyclic AMP. Thus, the endothelial cells bounded by the smooth muscle cells within the corpus cavernosum helps release nitric oxide, which has vasodilatory effects. Drugs within this class are usually therapeutic for patients with erectile dysfunction. Now, phosphodiesterase 5 inhibitors also have vasodilatory utility in the pulmonary system, which is sometimes useful in treating patients with pulmonary hypertension, considering the release of nitric oxide. Non-specific phosphodiesterase inhibitors, suggested by its name, doesn't have a specific function, and its pathways aren't almost entirely completely understood. However, they're known to enhance blood flow to the peripheries by increasing erythrocyte flexibility, which decreases blood viscosity, decreasing cellular proliferation, and ultimately decreasing inflammation. Examples of non-specific phosphodiesterase inhibitors are theophylline. Its adverse effects are quite large and non-specific for each medications, so I've listed some of the imperative ones which you need to understand. Now, vasodilatation can result into hypotension, and it's usually suggested to combine its use with catecholamines like norepinephrine and epinephrine. It can lead to reflex tachycardia, sometimes with palpitations. It can also lead to nasal congestions, some gastrointestinal symptoms like nausea. There has also been reported cases that phosphodiesterase 5 inhibitors can cause priapism in some individuals, so just make sure to take note of that. First of all, phosphodiesterase inhibitors can be used for pulmonary arterial hypertension since it causes pulmonary vasodilation through the release of nitric oxide and decreases pro-inflammatory processes. It can also be used in chronic obstructive pulmonary disease. It can also be used for decompensated heart failure, where the heart is unable to effectively fill the ventricles with blood or eject blood from the ventricles and into the veins. This obviously leads to a decrease in stroke volume and potentially a decrease in cardiac output. It can also be used for patients with benign prostatic hyperplasia, which basically means a decrease in testosterone, particularly in men, which leads to the eventual increase of cells within the prostate, ultimately causing it to be enlarged. And it can also be used in the prevention of post-surgical thromboembolisms as prophylaxis. It can be used for treatments in patients with thrombocytosis, where there's an increase of platelets in the bloodstream. This increases the risk of myocardial infarction and other possible complications. And finally, it can also be used in patients with erectile dysfunction. The class for this condition is usually from the phosphodiesterase 5 inhibitors. Just note that there are other indications for phosphodiesterase inhibitors, but I'm just listing some of the main and primary ones. Here are a few contraindications for some phosphodiesterase inhibitors. Please feel free to do your own extensive research. You shouldn't be using phosphodiesterase inhibitors on patients who are already on nitrates, as they can lead to severe hypotension. The use of xylostazol should be a contraindication to patients with heart failure or patients with bleeding disorders. The use of amrinone or milrinone are contraindicated on patients with aortic or pulmonic valve disease. Thank you so much for watching this video. If you liked this video and enjoyed watching, please feel free to like and subscribe to show your support. If you have any suggestions on how I can improve my videos, please feel free to comment on the video itself. See you guys next time.